So welcome everyone to Johnson County Community College and our Hospitality and Culinary Academy. My name is Michelle Riley and I am a registered dietitian and assistant professor here. And we're really excited to welcome you to Cook Right, Eat Right. I am going to first introduce Dr. Deborah Sullivan from the University of Kansas Medical Center, and she's going to introduce our presenters.
Thank you, Michelle. So as Michelle said, I am Deborah Sullivan, and I am also a registered dietitian and a nutrition scientist. I'm the chair of the Department of Dietetics and Nutrition at the University of Kansas Medical Center, and we are very excited that we are partnering with Johnson County Community College, the University of Kansas Health System, and then the University of Kansas Medical Center. And the three of us have teamed together to offer these nutrition education and culinary skills for the public. And so tonight's session is about nutrition for brain health, and we're very honored and excited to have our two presenters tonight. Our first presenter is Dr. Jeff Burns, and Dr. Burns is a neurologist, and he's the director of the KU Alzheimer's Disease Center. And our second presenter is Dr. Matt Taylor. Matt is a registered dietitian that has his PhD in medical nutrition science, and Matt, in his clinical work as well as his research, he researches nutrition and brain health, and so we've got two great experts to present to us this evening. So Dr. Burns.
All right. Okay, thanks, Deb and Michelle. So it's great to be here. So I'm just going to give a 10-minute or less overview of Alzheimer's and try to set the stage for what you're going to hear from Matt in terms of the importance of nutrition and brain health. This is something that we've been studying with Dr. Sullivan and Dr. Taylor for the last few years, and we really are focused heavily on how does lifestyle influence brain health. Really focusing on can we use lifestyle, exercise, and diet to improve brain health and reduce the risk of Alzheimer's disease. So I want to start with just sort of some fundamental ideas, and the number one question I get is what's the difference between dementia and Alzheimer's? So I like to start here, but dementia is a broad term that just means changes in memory and thinking or decline in cognition that interferes with daily function. So it's basically a syndrome where we see memory and thinking changes that interfere with an individual's ability to do the things that they've always done well. So we see some slippage in those kinds of memory and thinking skills that interfere with the ability to do the things that people have always done their whole life. Now they're having problems, and that's dementia. So it's a kind of simple idea, but it's a broad idea. And Alzheimer's disease is a cause of dementia. So the answer to the question is Alzheimer's is a specific cause of this broader syndrome of dementia. So you can see from this pie chart that Alzheimer's accounts for about 50 to 70% of all dementia. There's other things that cause Alzheimer's disease, like dementia with Lewy bodies, which is like Alzheimer's disease and Parkinson's disease combined. Frontotemporal dementia is another type of dementia, and then vascular dementia is a common form of dementia. And so the point is, many different things can cause dementia, but the number one cause is Alzheimer's. Now, what is Alzheimer's? Well, when somebody has Alzheimer's, we know it basically impacts the brain in a lot of different ways. One is we see what we call atrophy or shrinkage of the brain. And I want to just give you a sense of what this looks like, and Dr. Taylor's going to show you some slides where he talks about this shrinkage of the brain. But this is a picture of an individual who had mild Alzheimer's disease. It's an MRI scan. We're about halfway through the brain looking at the patient. And you can see in the middle is the dark area. It's called the ventricles. It's fluid-filled space. That's normal, but keep your eye on that. There's also fluid-filled spaces around the brain. So the white areas is brain tissue, and then the dark is fluid. And the arrows are pointing to the hippocampus. So this is the region of the brain where memories are, that's responsible for storing memories. So the hippocampus, if you remember anything from tonight or anything that happened today, tomorrow it's because your hippocampus put that information into the memory banks. Now, okay, so this woman has a little bit of atrophy. I see scans like this all the time, and I'd look at this scan and say, there's a little bit of shrinkage, more than usual, but not a lot. Now, she came back 2 years later, and it was in the moderate to severe stages of Alzheimer's. And I'm going to flip forward, and if you look at the middle of the brain, that the ventricle area, sort of the butterfly shape, you can see it's expanded. The space around the brain is also expanded, and then the hippocampi, where the arrows are pointing, they've shrunk. Now I'm going to flip back and forth, and you can see better as I do this how at baseline to 2 years you see a lot of shrinkage of the brain. And if you look at the white brain tissue, you see it's reduced. So basically with Alzheimer's disease, we see a lot of dropout of brain cells and a lot of shrinkage of the brain as the disease progresses. And this is what we see sort of on the big picture level in the brain of somebody with Alzheimer's. When we look at the brain under the microscope, what do we see? This is a picture of brain tissue from an individual who had mild to moderate dementia that was diagnosed as Alzheimer's disease in life, and when she died and her brain was examined under the microscope, we found amyloid plaques and tangles. So the big splotches in the middle are amyloid plaques. They're the buildup of this abnormal protein called amyloid outside of the cells, and then you see some sort of flame-shaped brain cells on the bottom left, middle left. There's 3 big ones that those are brain cells filled with what we call tangles, neurofibrillary tangles, or a protein called tau is the primary component of those. This is the hallmark of Alzheimer's disease, and this is how we define Alzheimer's disease, the presence of amyloid plaques and tangles in the brain of somebody who has dementia. That's the definition of Alzheimer's disease. And this is what we've been looking at for 100+ years since Dr. Alzheimer first described the disease, and it's what we've been targeting with our therapeutic approaches more recently, trying to block the buildup of these plaques and block the buildup of tangles to see if doing that can influence the disease or even cure the disease. That's the kind of research we're doing now. The drug studies we're doing now is looking at, can we bust up these plaques or stop them from developing in the first place and then have an impact on the patients. A bigger picture, how big is the problem? It's a huge problem. Alzheimer's is an incredibly common problem. About 1 out of 3 people over the age of 85 have Alzheimer's. So that's a pretty amazing number, 1 out of 3 over the age of 85. And that's the fastest growing segment of the population. So that's why we're seeing such a big increase in the number of people with Alzheimer's disease. It's over 5 million Americans in the United States and over 50,000 Kansans, and double that for Missouri. So this is a huge problem. The other big statistic is it's the costliest disease. It impacts our economy and society more than cancer and heart disease. So it's now the costliest disease, and it's only increasing. And that's why we need better drugs, and we need strategies, lifestyle strategies to reduce the risk. And that's why we're working so hard to do that. So we are one of the 31 nationally designated Alzheimer's centers, the KU Alzheimer's Disease Center. We were funded in 2011. Our mission's to find ways to improve the lives of people who are dealing with the disease and help the families who are dealing with it, and do it by finding treatments or a cure. That's what we're after, cure the disease, but then prevent it in those who don't have it, prevent it in people who are healthy. So find ways to keep people without cognitive issues, keep them that way, and prevent the disease from starting in the first place. And so all our research is really focused on those two goals: stop it in those who've got it, or prevent it in those who don't. We're also working. I actually think this goal is achievable, and we're going to get there. And it's to diagnose the disease before the onset of symptoms and stop it before it basically starts. And we're working on this from a lot of different angles. And I no longer believe that, or I no longer think if this is going to happen, but that it's a matter of when it's going to happen. So we're going to be able to spot the changes of Alzheimer's disease before anyone has symptoms, and then do something to stop it. And Matt's going to show you some pictures of brain scans where we're able to see the molecular changes, those amyloid plaques and tangles in the brain of living people, as opposed to what I showed you, which was in brain tissue from somebody who died with Alzheimer's disease. So that kind of technology is allowing us to see changes of Alzheimer's before any symptoms have started. And then we're working hard on drugs and lifestyle interventions to try to stop it. So the type of approaches that we're working on at the KU Alzheimer's Disease Center includes drugs, and it also includes exercise, and then more recently diet. And Matt's going to talk a bit about the diet studies. We have a focus on metabolism. Our center focuses on metabolism as a therapeutic target. So we're trying to find ways to boost metabolism in the body, boost metabolism in the brain as a way to potentially treat Alzheimer's disease. And we're testing that with different drugs right now, but we're also testing metabolic interventions with diet and with exercise. Those are metabolic interventions, and they influence the body's metabolism, and we think they influence the brain's metabolism. So this is one of the themes of our center. We've spent a good 10 to 12 years working hard to understand better how does exercise influence the brain, and can we use it to fight Alzheimer's disease. And we've done a series of studies, and actually 2 of them were featured by the New York Times, which is why those pictures are there, in 2015 and then I think 2017. But our studies have suggested and really support the idea that exercise does have brain benefits, even at low doses. So we did a dose response study where we found that even 75 minutes of walking on a treadmill has cognitive benefits for people without any memory problems. And then we also found in a study in people with Alzheimer's disease that evidence that exercise might slow that atrophy that we see in the brain, and it might slow the decline in memory that we see in people with Alzheimer's disease. And then if you're an exercise buff, that we're trying to understand what kind of exercise, how much, and sort of what's the right target for exercise. Is it building muscle mass, or is it building heart and lung function or blood flow? And we've found our evidence supports the idea that if you boost your heart and lung function with aerobic exercise, that's what it takes to see brain benefits. So all our studies have really pointed at that. If you're going to sort of focus your exercise on one thing, focus in on boosting your heart and lung function, and you do that by increasing the intensity and the duration of your exercise. So the optimal target, in other words, is increase heart and lung function. But we got a long way to go to really truly prove that these benefits exist definitively. Our studies are small, 80 to 100 person studies. We're now doing 600 plus size studies to really definitively prove it. We need to understand better, how big an effect does exercise have, what kind of exercise is best, and how much, and then the mechanisms. Why does exercise influence the brain? And you can say all the same questions about nutrition, diet, which we're really just getting started as a field. You see it in the newspapers all the time about diet studies and brain health and other health benefits, but the science has a ways to go in terms of the definitive proof and the rigorous proof, and that's where we're now stepping in and starting the NICE study, which you'll hear about, but trying to get the rigorous evidence that something like a Mediterranean diet can influence brain health. We're also doing that with exercise. So we have 2 major studies. These are 600 plus studies. One looking at vascular health, an intervention to improve vascular health, to really test the idea of what's good for your heart is good for the brain. We want to prove that what's good for the heart is good for the brain. We believe it, but the proof isn't entirely there. And so we're doing this vascular risk reduction study for people who have high blood pressure. It's a 2-year study, and we're looking to see if we can reduce vascular risk. Does that impact brain health over that 2 years? And then the IGNITE study we've designed it to be the definitive trial of exercise on brain health. 640 people, also same size as the RAD study, 640 people, looking at does 1 year of exercise, how does it impact the brain and cognition. We're doing a lot of different imaging studies and memory and thinking testing to really prove that exercise has an impact on the brain. The last slide here is we're working really hard with all the data we're collecting and the studies that we're doing to not just publish it in our science journals, but package it up and give it back to the community. And we've created a program called Lifestyle Empowerment for Alzheimer's Prevention. We've written a book. We have a curriculum that we give at retirement communities. We give it at the center, and we're trying to find different ways to get it out so that we can help people really translate the evidence that we're accumulating into everyday life and into strategies that we think will ultimately reduce Alzheimer's disease risk. So we're doing that in a number of different ways in rural areas like Emporia, and then we have a prescription-only LEAP program that doctors are prescribing, and we're testing if we give a doctor the tool to prescribe exercise and the patient that tool delivered at the YMCA's in Kansas City, will that improve people's health? And so the idea there is we're trying to innovate on how we deliver exercise and diet interventions to the public. If exercise reduces the risk of Alzheimer's disease, if it's something we can use to treat Alzheimer's disease, we're not using it very well. The clinicians and the medical field, we don't use it very well, and so we're trying to innovate around how do we deliver it and get people to start exercising and keep them exercising, and that's what the LEAP program is all about. So all right, so that's it. I'm going to turn it over to Matt, and he's going to talk about a little more nutrition. So thank you very much.
Well, thank you, Dr. Burns. It's always great to talk after him because he always gives a great illustration of brain health, Alzheimer's disease. And so my first slide is rendered pretty much already covered at this point. So I'm not going to go over basically the things that he had said, but what I kind of want to make the point of is I'd like to make a good case for you tonight about why it is that nutrition is important for brain health. So you heard a comment that what's good for the heart is good for the brain. That's what we think. That's what a lot of evidence in the scientific literature points to. And I see my brain actually covers that up. But we believe that if we're able to kind of address underlying heart health and control some of those things like high blood pressure, diabetes, and cholesterol, that in turn we're going to have a healthier brain. And one of the ways that we can do that is through exercise. So you get heart benefits from exercising, but you also get benefit from eating healthy as well. So what we have now witnessed over the course of a long period of time is that as cultures are and countries are shifting towards a more Western style of diet, that's where we're starting to see larger incidence of Alzheimer's disease. So if you're here in the United States, we have a diet that's usually fairly high in saturated fat. Some of these things have improved, and it kind of ebbs and flows a bit, but a popular way of eating is the Western diet here in the U.S. And so saturated fat, trans fatty acids are kind of on the way down just due to regulation a bit, but we still see a pretty high intake of refined sugars, processed foods, and then when you combine all of those things together, you ultimately wind up with too many calories. So all of these things seem to be contributing to overall brain health in a way. And in those countries, they have higher incidence of Alzheimer's disease. And a shining example of this is Japan. There have been some researchers that have looked at several different countries over a long period of time. And Japan has been a really interesting case study here in that over the past 40 to 50 years, there's actually been a pretty large increase and steady increase in Alzheimer's disease prevalence in Japan. And when you look at all the things that have been changing over the course of the years, it seems like diet and the rates of obesity are the two things that have really changed the most that could be contributing to that. So if we look at how that's changed, ultimately what has happened is there's a much higher intake of saturated fat from animal foods, from meat. Rice intake is basically half what it was about 50 years ago. So thinking about whole grains and that kind of thing. and sugar intake has almost doubled over that course of time. So these are all things that we know kind of contribute to the Western diet, and we've seen that steady increase in Alzheimer's. How many of you here are familiar with the Mediterranean diet? Anybody follow the Mediterranean diet? Kind of, a little bit. I figured a lot of you probably heard about it. It's a pretty hot buzzword, I would say, in nutrition right at the moment. And there's actually some nice evidence, observational studies that show that the Mediterranean diet might actually be helpful for having optimal brain health, and also potentially being a preventive measure or helping to reduce the risk of Alzheimer's disease. So diving into that a little bit, the Mediterranean diet really, it looks a lot like just an overall kind of what we think healthy diet, but there are a few staples that it's built upon. Fruits and vegetables are they're very important in the diet. And I should take a step back and say that the Mediterranean diet is intended to sort of emulate the type of eating patterns that are seen in the Mediterranean countries. And when we go and kind of look at overall health outcomes, you take like Greece, for example, there's kind of these blue zones. They're thought to have some of the healthiest people in the entire world. And so they look at that and they think, okay, well, how can we sort of emulate that in a way? And so that's really where the Mediterranean diet spurred from. A lot of olive oil gets eaten in those countries. Whole grains get eaten at a fair clip as well. And then a lot of fish. You've got some lean poultry, and people eat yogurt quite a bit as well for dairy. And in turn, with this diet, when we think about health, we also want to try to reduce the intake of things like saturated fat, refined carbohydrates, junk food, sugars. So those are things that we think might cause some damage. So I mentioned in research there's good observational data. There's actually not, right at the moment, there's not a lot of interventional research. And basically what that means is when you think about observational research, you think about kind of observing a person. So you have them enter a study, you ask them what they're eating, and then you look at the outcomes. You kind of characterize what they're doing and see what their outcomes are. Whereas intervention studies are a lot more rigorous and hard. You ask people to change what they're doing. Do you eat a Mediterranean diet? No. Okay, you're going to eat one for the next 3 years, that kind of thing. It's a little bit harder to do. But we do have some good observational evidence that points to the Mediterranean diet being protective. And I just highlighted 2 studies that I really like. The first one you'll see is they had about 2,200 people in this study. They enrolled these people, asked them what they were eating, so they reported what they were consuming on a regular basis. And then they basically divided them into 3 equal groups, so they were divided evenly. And they divided them into what they called the high, middle, and low Mediterranean diet groups. So they kind of classified them based off of, did you eat a lot of fruits and vegetables, did you eat fish, and did you eat olive oil and whole grains? So the people that were eating the most of those were in the high group, the middle amount were in the middle group, and the people that were low adherers to that, they were in the low group. And what we saw is that over the course of 10 years, that if you were eating the highest amount of those things, that they actually had the lowest incidence of Alzheimer's disease over that course of 10 years. And then the middle had a little bit better than the low group, and then the low group had the worst outcomes. And I think this makes a point that when it comes to diet, there's kind of no end-all, say-all on a lot of that, but that even just making small improvements in dietary habits can actually potentially have a pretty profound effect. The second was they kind of took the same approach, only they divided them into 2 groups, and they had people that were high, what they considered high fruit and vegetable, olive oil, fish, whole grain consumers, and then they had low. So you've got positive for high, minus for low. And what we saw is at that same time that those that reported that they ate more of a Mediterranean diet style, that they had more brain volume than those that didn't. And it was actually the most potent sort of thing that was contributing to brain health in that study. So I think really interesting. In our work, Dr. Burns referred to some of the amyloid that accumulates in the brain, and that we now actually have ways to image that in people that are living, so that's pretty exciting. And we had done some work where we looked at people that were older adults, and we basically asked what they were eating, and we saw that the more sugar and more junk food that people were eating, that they actually had higher levels of this amyloid in their brain. So kind of bringing in another piece showing that sugar intake and that things that are just kind of junky actually may be contributing to risk of Alzheimer's as well. So I'm getting pretty close to wrapping up, but before I get done, I wanted to leave you with a few recommendations. And so there's a group out of Chicago that's done some work on what they call the MIND diet. Some of you might be familiar with this. It's gotten a lot of press over the past few years. But it's sort of a take on the Mediterranean diet. It's really just what I would consider to be a healthy eating pattern, honestly. And so they have put forth recommendations that I think are very good. And so with their diet, they really base it off of vegetable intake. So they want you to eat one green leafy salad per day. A great big green leafy salad is best, actually. And then another serving of vegetables that day as well. To eat one serving of nuts per day, and those can be any type of nut, almonds, walnuts, cashews, you name it. Mix it up and you get more nutrients. Berries are the fruit that they focus on, so they want you getting at least 2 servings per week of blueberries or strawberries. And if you can get more than that, that's even better. Beans, I think, are really interesting because if we look at through the years over a long period of time, that cultures that eat more beans, they tend to have longer lifespans and much healthier lifespans as well. So there's kind of this really interesting finding that one of the most common foods consumed in the places where people are healthiest and live the longest is a lot of beans. So they recommend eating beans 3 to 4 servings per week. Those can be black beans, legumes, lentils, those types of things. Whole grains. And my point on this is just to try and mix it up with whole grains. Whole wheat bread, whole grain bread, it's great. But you can do things like oatmeal and farro and quinoa and those types of things, and they add a little more variety to the diet. Eating a serving of fish, especially like salmon or tuna. That way you're getting omega-3s for brain health. Supplementing protein with lean poultry and eating olive oil and drinking about 1 glass of wine per day. So I love cheeseburgers as much as the next person, but it's probably not the best brain food, I would say. So they also recommend things not to eat that often, and that would be to only occasionally eat red meat. Eat no more than a tablespoon of butter per day, and try to avoid margarine as much as possible. Reducing cheese intake, and trying to avoid pastries and sweets and fried food. So I can't get out of here without plugging a couple of studies that we have going on. So I do have 2. I've only got a slide for one, but we have flyers on both of them in case you're interested in either of them. And so we really want to put this, what's good for the heart is good for the brain, to the test, as Dr. Burns has with exercise as well. And so we've got a study called the NICE study where we are doing an intervention, and that stands for Nutrition Interventions for Cognitive Enhancement. We're going to be looking at brain biomarkers over a period of time, asking people to either follow a low-fat diet or a Mediterranean diet over that period of time, and look at the differences there and see. We actually think both will probably be beneficial for brain outcomes, but we want to really put to the test what might be the optimal way of eating for brain health. And the second is our milk study. And I should say that the NICE study is going to start enrolling in January. And so that one is upcoming. We do have one currently enrolling called the milk study. We did some research and showed that the more milk that people drank, they actually had higher antioxidants in their brain. So we can measure those with an MRI machine. And that was a really interesting finding. So now we're doing an intervention with that as well, where we're asking people that are over the age of 60 that drink less than or around 1 cup of milk per day on average. We have a 3-month intervention where we ask them to drink 3 cups of milk per day for that 3 months. So we'll measure their brain antioxidants at the beginning and at the end and look to see whether or not that intervention changed their brain antioxidants. So that wraps it up for me, but it looks like we're going to be moving on to the fun part. So thank you.
Thanks, Dr. Taylor. Perfect. All right, so now we're going to bring on Chef Aaron Prater. So Chef Prater has worked at Johnson County Community College for about 9 years. He also graduated from the chef apprenticeship here, and he's got lots of experience, not only cooking, but traveling and eating. So he's gonna introduce us to probably some new flavors that you guys may maybe never have had today. So welcome.
Thank you. So I'm going to make a couple dishes real quick so we have plenty of time for questions and things like that. One is a roasted cauliflower and chickpea salad that can be thrown together pretty easily. The only cooking is you put some stuff in the oven for about 15 minutes. I like this warm. I also like it room temperature. I don't really like to serve it cold because the cauliflower texture gets a little weird. So you guys will probably have that room temperature-ish. The other is we're going to make a pasta sauce with anchovies, and I'm going to start cooking the anchovies. Who hates anchovies? Yeah, probably most. Who's never had anchovies? Yeah, right, exactly. So I love them. I love them in this sauce, but if you don't like anchovies or you're a little bit afraid to try this, you could substitute just a can of tuna fish for this and get a similar flavor and get that serving of fish that you want to. So the first one we're going to make, I don't really have a name for it. We were just talking about, well, what would be good to eat? And I love beans, and those of you who've been to these before know that I'm going to use beans every chance I get. So we took some garbanzo beans or chickpeas, and we just roasted them in an oven until they get a little crispy. A little bit of olive oil, and we're using a spice blend called Ras Al Hanout. It's a Moroccan spice blend. It's got some cinnamon and some other things in it, but it's pretty fragrant, some cumin and coriander. So just a little bit of salt, a little bit of Ras Al Hanout, which you can buy at anything like a Whole Foods usually carries something like that. And then a little bit of olive oil just in a high oven, 400, even a little warmer. You just want them to get a little brown and toasty. They add a nice crunch to the salad. Cauliflower. Break it up into whatever size pieces you want. This is one of my favorite things in the world to eat just as a snack, roasted cauliflower with just a little bit of salt and olive oil. It's just fantastic as is. But this is a way to stretch it if you get tired of eating it or you made too much and you don't know what to do with it. You can, dump it into a little salad. Nuts are good. So we just took some pine nuts. You always want to take your nuts. If you've never toasted them, they always taste better if you just warm them up just a little bit. So in a dry pan with no oil, you just get some heat, and it can be hot, right? But you just kind of swirl them over your flame until they just kind of wake up. It warms up those oils. They become more fragrant, and you get a lot more flavor out of them. Raisins. We want some fruit, but you want a little sweetness, but you don't want too much moisture. And so I like the raisins because they're going to provide just a nice contrast to the spiciness and saltiness and sourness of everything in this dish. When we try to balance flavors, you try to put all these things into perspective so it's not a boring palate. So that's that. Parsley, because the more greens, the better, right? Even if it's just in herb form, the more the better. And then in my salad dressing, does anybody make salad dressing at home? Yeah. So one of the problems is a lot of these recipes for salad dressings are making like 4 cups of salad dressing. Well, what are you going to do with all that, right? So we're just going to make a simple vinaigrette style with lemon juice. I'm going to add just a touch of honey because need some sweetness. Honey's going to act as our emulsifier as well, so it'll keep the lemon juice and the olive oil bound together so you don't just have that runny, separated salad dressing like I grew up with, right? A little more Ras Al Hanout. This is just straight lemon juice. Fresh cracked pepper. And just a pinch of salt. Mix that up. And while I'm whisking, I'm going to slowly pour our olive oil in. As our friends at BP taught us, oil and water don't like to mix. I'm from New Orleans, so that honey's going to bind them together so we get a nice homogeneous mixture. And then we're going to take some arugula because we want those green leafy vegetables as much as possible. We're going to just pour our dressing on top. You're eating, what do you think? Yeah? This works better if we talk back and forth, for me, anyway. Because I'm busy, I'm staring down here instead of looking at you, so. That's it, right? But it gives you your beans, gives you the green leafy vegetables, it incorporates that healthy fat, that olive oil, so you're checking a lot of boxes with something really simple. And the only cooking I did was cut up some cauliflower and throw the chickpeas that came out of a can, just rinse them really good, and just throw them into the same oven. You could even put them in the same pan, really, because they both cook in about the same amount of time. I wouldn't put them in the same pan because the cauliflower is going to release some moisture, so it's going to take longer for your beans to crisp up. But so now we'll do some actual cooking once I get my mess out of the way. One of the things we always tell cooks in the beginning of culinary school is don't be afraid of fire, right? People always want to turn their heat on too slowly or too low. When you're cooking over high heat, when you're cooking fast, get your pan hot first. Always get your pan warm. So while my pan's getting warm, I'm going to bring over just a little bit of olive oil. I've got a good bit of anchovy. This is probably 4, maybe 5 fillets that I chopped up kind of fine. You can buy a tube of anchovy paste, and that works pretty good, and you just put a big old squeeze in there if you don't want to get your hands stinky with anchovies. But I want to put them in the pan, and we're going to cook them until they kind of break down and start to disintegrate. Because unless you really love anchovies, you don't want to take a big bite of just anchovy, right? Now, this dish shouldn't need too much salt because anchovies have salt. We're going to add some capers. They've been salted. We're going to add some olives. They've been a brine. So everything's kind of salty. So you shouldn't need to add salt. Cooking over this high heat, you can hear it quieted down. When I put the anchovies in, we're cooking that water out. As it quiets down, that tells me it's time to add my next ingredient. I'm going to put a little bit of onion in, and we're just going to soften it. I don't want color. I just want to kind of release those flavors. Like I said, if you don't want the anchovies, just dump some tuna in here. When the onion's softening, I'm going to put my garlic in. Garlic at temperatures like this wants to burn really quickly, and once it starts turning colors, it starts to turn bitter and it'll ruin your whole dish. So always add the garlic when you've got something else ready to go, and you only want to cook your garlic for 10 or 15 seconds. I'm going to add tomatoes. You can use crushed tomatoes. You can use tomato sauce. I prefer whole tomatoes, and if I wasn't going to get my hands dirty, I would squeeze them into my pan. That's kind of how my chef taught me to do it. But I'm going to leave these whole and just smash them with my spoon a little bit. There's a lot of different styles of puttanesca. Who's had puttanesca before? Anybody familiar with it? Right? I love this dish, but there's 100 different ways to make it. That's kind of the thing with Italian cuisine. There's no rules to it. Who makes the best sauce? Well, whatever house you're at, right? So I like it to be a little saucy, but I also like chunks of tomato. Canned tomatoes work great for this sauce. If you're going to do it in the summer and use fresh tomatoes, just cube them up and toss them in at the end. You don't want a whole lot of heat breaking down those fresh tomatoes. When the tomatoes are in, we're going to add some olives. These are Cauliflower. These are a bright green olive. I love this dish because the saltiness of everything brings out the fruitiness of olives. We forget that they're actually fruit, and they just taste great. Capers. Some fresh oregano. And I would cook this, especially if you're using canned tomatoes. Anything that comes out of a can tastes like it came out of a can, right? So you want to cook that sort of tin can taste away, and that usually takes anywhere from, 15 to 30 minutes. So I would simmer this a little bit, but we don't have that kind of time. So I've just got some pre-cooked rigatoni. We're going to dump it in here. Now, if I were really concerned about what an Italian would think, I would take a little of my pasta water, and I would add it in and finish cooking my pasta in the sauce with a little bit of that pasta water. And there's this concept called mantecatura where the fat from the sauce and the pasta starch kind of combine and make a smooth, creamy sauce. But a little bit of water just helps it stick to your pasta a little bit better. How'd this one taste? Yeah? We a fan, even with the anchovies? Yeah? And that's the nice thing is when you cook them and you add that acid from the tomato, they cook down, that strong fishy flavor cooks away, and you're able to enjoy that just savory richness that only anchovies really can bring to a dish. But again, if you're afraid, tuna fish works great in this as well. My job here is to make their information accessible and easy, right? I don't have a lot of studies or anything. I just cook because I like to eat, right? So I'm here to answer questions on how to incorporate these ideas that the doctors have brought forward into your life and make it easy. Because I don't want to make dishes that you've got to have special equipment or spend all day cooking for. I mean, you saw most of this stuff comes out of a can or can be fresh, and you cook it very lightly and quickly, and it doesn't have to impede on your life, right? Cooking shouldn't be a chore. You should enjoy the food that you make, right? So we enjoy it. We happy? Yeah. This is puttanesca, pasta puttanesca. I don't have a name for it. We just made a roasted cauliflower salad. How about that? Yeah. This is Castelvetrano, which is a bright green. They're pretty trendy. You kind of see them all over the place now, but it's kind of a meteor olive. I really like the texture. But you can use any Spanish green olive or a Kalamata even.
Well, thank you. You guys all like the recipes? We full? Yeah? Good job. We do have a few more samples in the back if anyone, when you leave, if you snag them. But thank you guys for coming so much. Next month is going to be healthy holiday baking, so it'll be a little bit different than our normal topics. But we have one of our pastry chefs joining us and some great people from KU, so we're really excited about that. Just look forward to seeing you. So thank you guys for coming.